While Trump intends to ship Ebola patients to Kenya, guess what MPs in parliament are doing?
Mr. Speaker, I've been in a shop right now. I went to buy an Arsenal attire. Mr. Speaker, the line that is there, the shop is full and the shop is called East West Sportswear on Moi Avenue. Honorable Speaker, Arsenal is the team to watch, and Saturday we are prepared, Mr. Speaker, all of us to cheer Arsenal as it wins the next month. Thank you.
Thank you.
But Mr. Speaker, I must declare my interest that Manchester United, the great Manchester United, is my team of is the team that I support, Mr. Speaker. The great team that even remembers when they last won this Premier League, not teams that won this Premier League last when some children who are already adults, grown-ups, were not even born, Mr. Speaker. And they have just won this Premier League by fluke, Mr. Speaker, and we know the real champions shall be claiming their place in the next year's tournament. Thank you very much.
They're literally out of motion. Well, this is US President Trump trying to ship Ebola patients to Kenya. As if that is not enough, this is what the CS of Health had to say.
So who will be able to access this facility?
Well, so Kenyan KDF soldiers, do they need permission from anybody to access?
Okay, so you're saying this will cater for KDF soldiers and US nationals?
Yes.
Okay. Who
and it's another thing.
Said it will be manned by Kenyan personnel. Or who will be manning it?
I have told you, Kenya Defense Forces has the most robust health specialist of any kind.
But I've read that we've had
I'm saying
public health officials.
No, I'm saying yes, KDF. You go to Mbagathi, they are level 6 hospital. So Kenya Defense Forces at the rank, in terms of the rank, the base commander and the Air Force commander will man.
Okay. So what about
but in terms of health personnel, it will be between the Kenyan health personnel leading, working with their colleagues from the US.
So there will be US health personnel.
Of course.
Aside from the 1.7 billion shillings, what is Kenya getting? Is there any more money that we'll get? Is it a case of we are indebted because you said the US has contributed significantly?
No. Let me tell you, the 1.7 billion is for this Ebola support, okay? Whether it is building the capacity of our labs, whether it is employing more healthcare workers, whether it is on buying reagents for the testings in the labs, whether, and you know, as we sit here, when we are testing for Ebola in our country, we work with the US CDC. Cambridge is one of our lead labs, okay? Cambridge works with Wellcome, which is the British partnership. Cambridge works with CDC, Africa. Cambridge works with WHO. So there's no way Kenya can be isolated from the global health security. And that's why we, even in our partnership, we are guided by the international health regulations of 2005.
As weird as it may look, well, this is the state of our hospital. Well, we have patients who are sharing beds because we have insufficient facilities, or we have insufficient health facilities. The CS also says that we should be proud as Kenyans. It is a moment for us Kenyans to be proud because other countries are starting to believe in us, or other countries are starting to believe in our healthcare. But we are asking, are they truly believing in our healthcare? Or is it because we are a third world country that survives on loans from them? Just a simple question that we are asking ourselves. Because frankly speaking, we have so many options. We have so many options that Trump can choose to build this Ebola facility. But why is he picking Kenya? Of all the facilities, or of all the places he can build these facilities, why Kenya? Kenya is struggling in healthcare. Kenya is struggling with the leadership that we have, and they sit back and put our lives at risk. While Trump himself, this is what he has had to say about his own citizens who have Ebola.
The number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States. And so the State Department and other agencies represented here, the Centers for Disease Control, HHS, others, are working very, very hard to contain this crisis to the countries where it's currently located, particularly the Democratic Republic of the Congo. And so we've surged assistance to make sure that is being contained there. And obviously, multiple agencies involved here are also very involved in tracking people, just to make sure that nobody comes into this country that has Ebola and creates a problem for us. And we feel like we've got good efforts in place to do that, and Americans should feel assured that the President and his administration is doing everything we can to protect them on that front.
So let's be for real. If it was Tanzania or it was Uganda that wants to build a facility in Kenya, maybe we could actually understand that a little bit. But it's US. They have the ability. They have better healthcare compared to Kenya. Man, this is the price that we have to pay for accepting colonialism. This is the price we have to pay for taking the loans, because nobody will stand and refuse. You still want to maintain that good friendship between Kenya and the US. At the end of the day, we are going to turn to them when it comes to loans. When exactly is enough? Because as much as Kenyans are crying enough is enough, leaders are not seeing that. We continue to cry daily. We continue to get hurt. It never gets better in this country. This is the price we have to pay.